Hi everyone, welcome back to the Aspect Health channel. I am your host Alicia and I'm with our Chief Medical Officer, Dr. Faris, who has a lot of experience on the topic of PCOS and women's health. We're diving into the intersection of mental health and PCOS, one of our most highly requested topics by you guys, so we're looking forward to dive deeper into this today. Dr. Faris, as always, thank you so much for being with us here today.
Hi, Alicia, and hi everybody. Hey, thank you. I love when we do these.
Me too.
Because I feel like we really get to spend time doing a little bit more deeper exploration of these topics.
We're going to break down everything for you so that by the end of this video, you gain a better understanding of the link between the two and hopefully the tools and resources to get you on a path to better mental health. So without further ado, let's start from the very beginning. What is polycystic ovarian syndrome and why is it so commonly linked to anxiety, depression, and further mental disorders?
This is a hormonal disorder that affects women and people with ovaries. It's a hormonal and a metabolic disorder. So I always like to start with that, meaning it's a disorder that impacts your hormones, your reproductive hormones, and then also on the other side, which we mentioned, that it's a metabolic disorder. And so there are other hormones involved with our metabolism, namely insulin is the big one here that impacts PCOS. And these two systems sort of interact with each other to make this disorder. So a disorder is a group of sort of related symptoms. Each person's sort of presentation of a disorder can be different. And so we certainly see that with polycystic ovarian syndrome, that each person has a slightly different presentation. That's why we always talk about trying to figure out sort of your personal PCOS and your brand or your flavor of PCOS.
Right.
But generally speaking, people with PCOS experience some sort of disruption with their menstrual cycle. So this could be irregular or absent periods, delayed ovulation, this sort of appearance on ultrasound of having lots and lots of follicles on the ovaries. So the ovaries just sort of get swollen with these little tiny cysts that contain eggs. People with PCOS often have elevated androgens, which results in some changes to a person's appearance, like facial hair or cystic acne, balding, some other skin changes like skin tags and sort of darkening of the skin in certain places. And somebody may have any sort of combination of these different features when they're diagnosed with PCOS, but it goes beyond that, which is what we alluded to and what we're talking about today, that PCOS is a whole body disorder, that it impacts the brain, it impacts energy levels, it impacts cardiovascular health. And I think that is often ignored. And that's why we're going to talk about mental health and PCOS today. I want to start by saying that, because this is sort of where it gets confusing, right? That mental health disorders or even symptoms, of depression or anxiety are not symptoms of PCOS, okay? We want to make sure that we're very clear that people who have a diagnosis of depression or a diagnosis of anxiety, that is a disorder in its own right. That's a medical condition in its own right. What we do find is that there is a higher likelihood for somebody with PCOS to also have anxiety and or depression. And so that's why we're talking about them both today.
Maybe I'm the only one, but just in case somebody kind of has the same confusion like I do right now. So you mentioned how, of course, depression, anxiety, that's a medical condition in its own right. But essentially what you're clarifying here is that people who have PCOS are more prone to also have depression and anxiety.
Correct. So we don't want to say that, PCOS, that depression and anxiety are a symptom of PCOS, and that if we treat PCOS, we treat somebody's depression and anxiety, because that wouldn't be fair, because depression and anxiety requires certain treatments, but they do occur more frequently, right, together. And, I don't love the term root cause, but I think it's actually appropriate in this scenario that there's probably a common root cause to both these mental health disorders specifically and PCOS. And so that's probably why they coexist more frequently.
What do you think this root cause is then that contributes to these mood symptoms that we observe in PCOS?
I mean, we don't know exactly, right? But insulin resistance could be playing a role. If there is some defect in insulin signaling that's present in somebody's ovaries and other cells of their body, why would it not also be present in the brain? If your brain cells are not able to access the energy it needs at the appropriate rate, we know that other people that have insulin resistance, other disorders that have insulin resistance also have higher rates of depression and anxiety. So there is probably a link there. And then the change in the hormones, in the reproductive hormones, whereas people with PCOS have higher levels of androgens than women and people with ovaries that don't. That those sort of higher level of androgens also play a role in the brain.
We mentioned a little bit about insulin resistance, and I'd love to kind of dive deeper into the topic. How does that correlate to how someone may feel throughout the day, like as far as cognitive function and just energy levels?
So let's talk about what insulin resistance is a little bit. One of insulin's jobs, one of insulin's roles is to bind to a cell, and this tells the cell to open up and allow glucose in, that's energy, into the cell so the cell can carry out all of its functions. There is a slowing of that process. If your cells don't have energy, they're not going to function as quickly. This can happen in your muscle cells where you feel physical fatigue, right? You're like, I just don't have the energy. I don't have the power. It can also result in mental fatigue or brain fog because your brain cells are maybe not metabolizing the energy as quickly as they could be. And people still feel like they don't, even if they ate, right? It's because there's that delay. It's not that the energy is not getting to the cells, it's that it's delayed.
Like mood swings and irritability that sometimes people with PCOS experience, does that also have to do with the insulin resistance, or is it something else at play?
It can, right? It can, as these sort of energy levels fluctuate, increase, decrease. Sometimes people with who sort of have long-standing insulin resistance, the body responds by producing more insulin. And so you have this sort of sluggish response where the energy maybe doesn't enter the cell so quickly, but then you may also have an overshoot where now the blood sugar drops rapidly after a meal, and then people feel these sort of highs and lows, and the lows can feel really bad. They can cause people to have sweating and have their heart race and almost feel like they're having a panic attack or having anxiety. And that can be due to sort of this abrupt drop in the blood glucose. And so these ups and downs certainly have an impact on function and therefore on mood. And then we also don't want to underappreciate the impact having a difficult to manage, not well understood chronic disease also has on somebody's mood. Feeling like you don't know what's wrong with you, feeling you're not really sure how you're going to effectively get through the day, get your work done, like when you're feeling lousy, when you don't have the energy, how that impacts somebody's mood and self-esteem and all the things and body image if you have some of the dermatologic symptoms or the weight gain that can go along with PCOS. So we don't want to downplay that as well.
With your experience throughout helping your patients with polycystic ovarian syndrome, of course, you also have a big expertise in nutrition. Do you see kind of the slippery slope of falling into an eating disorder with PCOS, and what perhaps can somebody do to not fall trapped to these disordered eating habits?
Yeah, I think it's challenging, especially for women who are maybe in adolescence or early adulthood when they're dealing with this. And oftentimes before getting a proper diagnosis, and even maybe after getting a diagnosis, the information that's provided is often not great. If people are experiencing weight gain, what are they told? What are they told by their peers? What are they told by their parents, their family members, and even their doctors about what they should be doing, right? And so there's this feeling of self-blame that it must be something that they are doing, not understanding that this is a condition, that it's not their fault. It's not their fault because they're lazy. It's not their fault because they eat too much or they don't eat healthy or whatever, that they're doing all of these different things. And I think that's where it starts.
Of course, aspects, one of our primary focus is PCOS. So kind of when I first started and learning about it and going on social media, I think especially social media, there's such a focus on losing weight, quick fixes, or targeting like PCOS belly fat, or like these like hyper like targeted insecurities that pick on people's insecurities essentially and focus on these quick fixes, or that something needs to be even fixed. I think that's such a huge topic. It can even be a video in itself. I mean, even that BBC article that came out when it was talking about those influencers and selling these like fake cures for PCOS, a lot of these women mentioned how they were already dealing with such disordered kind of eating because of these diets that were pushed on them, or this a lot of blame, than even having a worser relationship with food after trying so many diets. So I think one thing that I love what Aspect's doing is almost, like you mentioned, undoing kind of all of that information that we've been told and doing it in a way that feels right, that works with your body and not against it, and not restricting food groups, but just nourishing yourself rather than malnourishing.
And that's why we're here, right? That's like you and I, we talk about this all the time, right? That we're really trying to provide accurate information to people, because there is so much garbage. There's so much predatory information, like predatory just advice out there, and people trying to sell things. And like, I mean, let's be honest, we work for a company that has a product that is a digital product that's designed for people with PCOS. But as you said, you know, we're trying to personalize and, you know, help people identify that it is a chronic disease, that it's not a quick fix, and that we really are trying to provide people with a companion that they can help them to live their life, right? And so manage PCOS for the long term. And it's in part due to, you know, lack of really great available resources in the conventional healthcare system. Lack of access to resources, not great advice being given. There is, you know, stigma around PCOS and around obesity. And then there's just all of society's pressures, right? That make people really, really vulnerable. So rebuilding that trust is important. You know, we're trying to do that by providing reliable information. Everything that we put out there has been sort of thoroughly researched and vetted. And as new information comes out, you know, we update, and we really are just trying to educate people. So
how can someone be able to tell that their mental health is taking a toll? So they have PCOS. What are some signs that they should look out for that is telling them, you know what, this is starting to become an unhealthy pattern with my relationship with food, or whether that's anxiety or depression? Maybe you've noticed yourself some common symptoms in your patients with PCOS. What are some key things that you think we should observe and have in the back of our mind? You know,
everybody gets nervous from time to time. Everybody feels down from time to time. But when it goes beyond, when you really are experiencing depressive symptoms, where you really do just have negative intrusive thoughts, where you're, you know, potentially thinking about not wanting to go on, not having the will to go on, not feeling like living, even if in a passive way, not even in an active way, but just having these thoughts that really are making you lose hope, this feeling of hopelessness, that's disruptive. When you're feeling like you don't want to get out of bed and do the things that you need to do, right? Go to school, go to work, take care of your family, like whatever your responsibilities are. If those things are being interfered with, your anxiety is impairing your ability to make decisions about life. You can have anxiety and you can learn some techniques on managing your anxiety, but when it's interfering with your ability to do things, the same goes, you know, with if your attitudes towards food, if you really are afraid to eat, if you are not eating, or if you're binge eating, if you're eliminating whole food groups, or sort of obsessing over your food intake because you're worried about how it's going to impact your PCOS, you need some assistance with it. You need help with it. If you need help, there's help. If you need medication, there's medication. If you need therapy, there's therapy. If you just need a support group, there's a support group. What's great, about Aspect is we have coaches who are they're there to help support you, and they understand what your challenges are so that you can help implement. They're also really great at identifying when things are overwhelming or maybe you need something beyond. And so to recognize, hey, maybe you actually need a therapist, or maybe you need to talk to your doctor about a medication for this. And so that's really important to not go it alone, I think, is the biggest key. So finding reliable, trusted partners for you on your journey towards better health.
Focusing a bit on stress, if somebody with polycystic ovarian syndrome is experiencing high amounts of stress in their day-to-day life, how does that then influence their symptoms and what's going on inside? So
when we have emotional distress or stress, our body responds by producing some hormones from our adrenal glands, adrenaline or epinephrine, cortisol. It raises your heartbeat. It makes you more alert, right? But if it's chronically stimulated, meaning all day long, right? You just have one stressor after the next, you don't catch a break, then you're constantly producing these stress hormones. They can have a negative impact on your health, on your feeling of well-being. Cortisol specifically is a stress hormone that's produced by your adrenal glands. It's a very important, right? We hear about cortisol all the time, so I'm glad we're talking about it because it's definitely trending, right? People talk about lower your cortisol, lower your cortisol, test your cortisol, all these different things about cortisol. If you didn't have cortisol, you wouldn't wake up in the morning, right? It's a crucial hormone. It keeps you alive, right? If you didn't have cortisol, when your blood sugar dropped a little bit too low, you die. It's not that we don't want any cortisol. Right? We'd feel horrible without it. It makes us feel alert. It makes us wake up in the morning. But first of all, there's a circadian, rhythm to it. It should be higher in the morning and it should taper off as the day goes on and as you get towards sleep. But if it's constantly triggered multiple times per day, every single day, a few things happen. Cortisol is going to raise your blood sugar. So if you have insulin resistance, it's going to work against that. So it impairs insulin sensitivity. And then second, the adrenal glands, when they're being stimulated to produce cortisol, they actually also produce some extra androgens. And these are weaker androgens, but those, if they're either too high, they also can produce some of the androgenic symptoms. And then if they're then converted into testosterone, which is the more potent form, you certainly will have more symptoms, and that can interfere with your menstrual cycle, etc. Finding ways to mitigate, chronic stress is really important. It's not so much about having it be too high, because oftentimes it's a very short-lived hormone, so you won't necessarily identify it in a blood test, right? People always want to test my cortisol levels. Yeah, it's not going to necessarily tell you anything. It's about how often is it stimulated, and if it's just sort of chronically stimulated, because cortisol kind of comes and goes. It's a very fast-acting hormone that also is broken down quickly, so you may not see it in a blood test, or even like any home test, might not be elevated. But if it's just chronically stimulated, then that can impact your PCOS as well.
How is someone able to differentiate that the amount of stress that they feel during a day is normal versus this is actually chronic stress? Because I feel like maybe for somebody who's feeling chronically stressed, maybe they don't even know. For them, that's normal, but it's actually not. What do you think those two key differences are?
That's a very, very good question. Because some people get really stressed out over small things and other people, are a bit more resilient. And is it just because you don't acknowledge it, right? It's really hard to say.
Yeah.
We do have some measures, like you can measure your heart rate if your heart rate is always high, or there's another measure called heart rate variability that a lot of these wearable devices use as a measure of stress. That could indicate that you are, experiencing chronic stress. But sometimes it's like, your body tells you. Are you having headaches? Are you having a lot of gastrointestinal distress? Like, are you having, a lot of stomach pain, heartburn? Are you experiencing diarrhea or constipation? Are you finding that your heart is racing? Are you feeling palpitations? Like, these are all some physical manifestations of stress. that paying attention to. And just if you know you're not really taking any time to have downtime, sometimes you can't, right? Sometimes life just gets in the way, but it's important if you are really, really busy and do have a lot of chronic stressors that, you do make sure. And then if you are one of those people, if you're like, gosh, I really can't figure out what is going on with me, right? I'm doing all the right things, but actually you're just busy, and you've got a lot on your shoulders and you've got a lot weighing on you, and you have PCOS and your symptoms are not improving, well, then maybe it's time to actually look at that and the burden of your stress, right? What does it hurt you to take a little bit of time and learn some stress management techniques, whether it's simple breathing, whether it's just finding a hobby, taking a little time for yourself. If you've tried everything else and nothing else has worked, why not try some, stress management and see if that doesn't improve some of your symptoms, right? So sometimes our body tells us, and that's the test. We all want now home tests and simple, quick tests of everything. Sometimes the test is actually trying something and seeing how your body responds.
Right, and I guess there's nothing to lose for that.
Yeah, there's nothing to lose, exactly,
Only
right?
to gain.
Yeah, nobody's been harmed by meditation, right?
Yeah, exactly. So can treating PCOS symptoms, like managing your glucose levels to better manage your insulin resistance, then help you with symptoms of anxiety, symptoms of depression, and vice versa? And if so, how? How does these two interplay?
Yeah, it's a great question. So if you helping to manage your PCOS symptoms, your insulin resistance is helping your metabolism, then that's going to help your mental health, right? And if it also helps to lower your androgen levels, that's going to help your mental health. And vice versa. If you have an improvement in your mental health, then it's going to be easier for you to engage in self-care, right? When we feel down, when we are depressed, and we don't care as much about ourselves, we might not treat ourselves as well, right? We may not do the things that are good for us, that show ourselves that we love ourselves, right? If we're not feeling good about ourselves, if we're depressed or our self-esteem is low. And same if you're just sort of, anxious and if you're having a lot of anxiety, you may not be able to make the best decisions all the time. That can be interfering in your ability to make decisions. So they help each other, right? So having better mental health is going to improve your ability to self-care, and having better metabolic health and hormonal health will help to improve your mental health. So they go together.
What are some of the most effective ways then that we're able to help with our mood disorders, mood symptoms, whether that's brain fog, whether that is anxiety and depression?
Yeah. So, nutrition is very important. That's where I'm always going to, right? Always going to start. Nutrition is very important. Making sure that not only are you addressing your insulin resistance by, eating well, giving yourself good sources of sustained energy, making sure that you're also getting all of your micronutrients. There's important nutrients that are important for your brain, making sure you're getting your B vitamins and your essential fatty acids and all the anti-inflammatory nutrition that's important for brain health. And then doing the things that are important like sleep hygiene and stress management, right, are going to be really important for your mental health. So all of those things, addressing your insulin resistance, making sure you're getting all of your important brain nutrients, and then, sleep, exercise. Also, we haven't even talked about exercise and its benefit in terms of mental health. And then from the mental health standpoint, making sure that you're getting appropriate treatment, right? So that means if you're somebody who really does struggle with anxiety and or depression, you should have a therapist. Therapy is very helpful, helping you to sort of address and self-care. If you need medication, that's okay too, right? There's no shame. So I don't want people to think, oh, I just need to fix my PCOS and then I'm not going to need anti-anxiety medication or anti-depression medication, right? As a nutritionist and physician, I believe we should use all of the tools in our toolbox and not one is better than the other, right? We find the formula, we find the recipe that works for an individual. Each person's going to be different. So don't think that, oh, I wasn't able to solve my depression or anxiety naturally or by treating my PCOS, that there's something wrong. And then having support. You need to find people who are on your team. So whether that's friends, family who get it, because oftentimes they don't,
Yeah.
a support group, a coach, whoever that might be.
Of course, people with PCOS, around 70% of them struggle with insulin resistance. How important is it to optimize your glucose levels to then feel better throughout the day and just in general?
So again, as I mentioned before, insulin has a few different functions. One of its main functions is to signal the cell to open up and allow energy in. In people with PCOS, there is some defect in most people with PCOS in that process, so that it occurs, but it occurs more slowly. So what that ends up happening, it means that you just sort of have this delayed response and to your energy obtained from a meal, right? We eat food gives us energy, but there's sort of this delayed entry. So you may still feel low energy after eating. You may still feel hungry, and the brain doesn't sort of recognize that you have eaten enough because there's a delay. As a response to that, depending on how you eat, pancreas will then produce more insulin to compensate. So eventually the excess insulin will kick in, and now blood sugar will drop more quickly. So you'll feel like, gosh, I feel lousy. I don't feel like I've eaten. I still am hungry. And then you may feel good for a little bit and then sort of crash again and feel really low energy and feel hungry again and feel like you have to eat again. And so it's this sort of roller coaster of feeling hungry, tired, fatigued, eating, feeling good for a little while, then feeling really kind of lousy, and then sort of eating and then sort of starting that whole cycle all over again. So that's just the insulin resistance sort of piece on its own. In people with PCOS, insulin can impact PCOS by producing more androgens, right? It stimulates the ovary to produce more androgens, and that's going to give you some of the symptoms associated with acne, weight gain around the middle, facial hair, etc. So your question is, how do you address this to sort of make you feel good throughout the day? And it's to provide your body with enough energy to function and feel good, but not so much that you overwhelm your body's ability to use that energy. So it's finding that sweet spot. That's going to differ for each person. But I'd say one of the biggest sort of levers we can pull is making sure you get enough fiber. I think that's really important. Many different sources of energy, and carbohydrates is our main source of energy. And we have ones that are fast, that are very quickly digested and absorbed, and ones that are sort of digested more slowly and absorbed more slowly. And we want to choose the ones that are digested and absorbed more slowly. So it gives your cells an opportunity to use that energy. Glucose, which is our body's like currency, big energy currency, blood sugar, to not peak too high and not drop too high. Our goal is to sort of keep them more level. You're going to see some peaks and valleys, right? That's normal, but we want to avoid huge peaks and valleys, and doing that by giving us sort of slower, sustained energy. And that's our strategy. And there's so many different ways that we can accomplish this, by including more fiber, by choosing the appropriate portion size for yourself, by choosing those slower carbs, crafting your meal so that it is not carbohydrate, that it makes sure that you have carbs and fiber and protein and a little fat. And so you have these well-rounded, well-balanced meals, timing the meals appropriately. So there's all these different things that we can do to help people learn sort of what formula works for them, what sort of strategies work for them. And that's really what we do. That's really what it's all about. It's not a one size fits all, but certainly there are many strategies that we can utilize and try. And that's really the aim. The aim is steady energy so that you feel good, so you're able to accomplish what you need to accomplish without feeling those lows.
What's one piece of advice you wish more people with PCOS knew about protecting their mental well-being?
Appreciating that PCOS actually does affect the brain. I think just hearing that for people is such a relief, because it's not something that you can just like put your finger on, right? Or test for. So I think just acknowledging that for yourself and realize, oh, this is actually part of the process, and it's going to get better as I get better. And there may be good days and there may be bad days, but I just think acknowledging that goes a long way.
For sure. I think especially because you can't see it, I guess. It's something that others can't see, and I think can be easily not acknowledged or like very overseen or ignored. Like we talk a lot about the physical aspects of PCOS, but oftentimes it's the things that we cannot see hold just as much.
The daily struggle, right, that people
Yeah.
with PCOS really experience, especially with the fatigue,
right? Yeah.
And then they're, told that they're lazy by people, family members, friends, colleagues, bosses, whoever that might be.
And my last question is, how can partners, friends, and family support someone struggling with both PCOS and mental health issues?
Just think about how you would want to be treated. Understand that people with PCOS have a chronic medical condition, right? This is a chronic health condition. You sort of putting them down, telling them they're not trying hard enough, asking questions like, what's wrong with you? Why can't you just do X? Why can't you just do Y? Is not helpful, right? Yeah. So ask people what they need. Ask people what they need. Be supportive. Ask them what they're doing. Most people with PCOS are trying really hard. Acknowledge them. Acknowledge what they're doing. And ask them how you can support them. What do they need? What could help them to be, more successful in their efforts to care for themselves?
For sure. I think a big part also is like the education. I think people are quick to judge if they just don't understand. And I think the more you know, the better you do, I guess. So I think it's also something that a lot of people are needing. Like we posted that one video on your account and it was like PCOS explained for your partner. And it got a lot of attraction and it just kind of made me wonder, like I think that there's this big need for people with PCOS to feel understood, especially by their closest circle of people that support them, because of course I can imagine for someone that doesn't understand PCOS, it's very easy to judge on the outside. Oh, but you're not doing this and this and this. You should be doing XYZ. And it is coming, I guess, from a place of love, but at the same time it is hurting because they don't understand the actual reality of what's going on.
I'm so glad we did that video.
Yeah.
Reading the comments made me really sad.
Yeah, me too. It made me very emotional.
Made me sad.
Yeah.
Made me very emotional just thinking about what people experience. So I'm glad we do it. I'm glad we did it. And I'm glad people really appreciated it and shared it. And I hope it was valuable. And I hope it helped people and their family members and their partners
for sure
understand a little bit better and give them some grace. And so, that one really touched me.
I think this is a perfect ending to today's topic about mental health and the intersection with PCOS. We really hope that whoever's watching this, struggling with PCOS, struggling with their mental health, can take something away, can find the right resources, right tools. Perhaps you have inspiration, whether to reach out to your partner, reach out to your family and loved ones on how they can better support you. Hopefully this video allowed you to give yourself a bit more kindness, a bit more empathy to understand that this is a part of PCOS. It's not your fault, but that there definitely is a community out there to help you. Aspect is one of them. I'm here to provide you with good, reliable information so that you can just understand and know better of what's going on, and just that way you can take care of yourself better. So if you learned something new today, please show us by liking, subscribing, so that you can be alerted when a next video like this will come out. And as always, if you have any questions, suggestions for next videos, leave them in the comments below.
Share the love.
And share,
right?
yes.
Share the love.
Absolutely, that as well. Share it to a fellow friend, partner, loved one, whoever is close to in your life who you think could also benefit from this information. So thank you again for being with us here today. Thank you for sharing your knowledge, and we'll see you guys in the next video.
Bye, everyone.
Bye.